Okay, knock knock. Okay, I'm going to perform hand hygiene, pull the curtain for privacy, put my gloves on before I get to my patient. Okay.
My name is Gabriella Ortega and I consent to recording this video.
Okay. My name is Renee and I'll be doing your head to toe assessment today, and I will be doing patient teaching on your tonsillectomy, okay? Can I see your wristband? Can you tell me your full name and your birthday?
Gabriella Ortega, 8/16/07.
Okay, Gabriela Ortega, 8/16/07. Okay, thank you. Okay, at any point if you feel uncomfortable, just let me know, okay? Okay, I'll start with your head. Okay, no abrasions, no lumps, no thinning of the hair, normal cephalic. Okay, any pain?
No.
Okay. Now we're going to check your temporal pulse, okay? Okay, now I'm going to palpate your sinuses. Any pain?
No.
Okay. Now let's check your lymph nodes. No pain?
No.
Okay. Now I am going to see. Let's check your neck, and we're going to be palpating your lymph nodes. Now we're going to palpate your trachea. Okay. The trachea is midline. Okay. Okay, that looks good. Now I'm going to ask you a couple questions, okay? Okay. Do you know where you are?
Yes, in the hospital.
Okay. Do you know why you're here?
My tonsillectomy.
Do you know who the president is?
Donald Trump.
Okay. And do you know the season?
Summer.
Okay, perfect. Okay. So she's A&O times 4. Now I'm going to check your eyes with the pen light. Before I turn it on, I'm just going to have you follow the pen light, okay, with your eyes. Okay? Okay. Now I'm going to turn on the pen light and we're going to check your pupils, okay? Okay. Okay, your pupils are they're perla. They're yes, they're perla. Now we're going to, can I have you hyperextend your neck like this? Perfect. Okay. I'm going to get my pen light. Let's turn it back on. Now we're looking for any let's look at your jugular vein, no jugular vein distension. Okay. All right. Now we're going to check inside your nose, okay? Okay. Let's see. Can I have you hyperextend your head back? Okay. So it looks pink and moist with no occlusions in her nose. Now I'm going to have you cover we'll cover one side of your nose, cover one nostril. Okay, and breathe in. Okay. Go ahead and take your finger off. Any problems breathing in? Okay, let's do your other side. Breathe in. Okay, no problems?
No.
Okay, so no problems, no problems breathing in. Let's check your ears now, okay? Okay, let's check your other one. Okay, so the ears are gray, no cerumen. The tympanic membrane can be seen. Now we're going to do a whisper test. So I'll have you cover one ear, and I'm going to whisper a number in your other ear, and you're going to repeat it, okay?
1.
Okay, cover your other ear. Let's do it again.
5.
Okay, perfect. Okay, we did the whisper test on both ears. Now we're going to, we did the jugular vein distension, and now we're going to I'm going to have you shrug your shoulders. Okay, go ahead, put them down. Let's move your hair. Okay. Now I'm going to put pressure on your shoulders, and you're going to try to shrug your shoulders, okay? Okay. Okay? Okay, perfect. Go ahead, relax. Okay, now that we did that, can you move your neck side to side? Any pain?
No.
Okay, perfect. Okay, now that we did that, let's see, we're going to, we did your neck side to side, you had no pain. Now let's check your skin, okay? So let's see, can I see your hands? Okay. Now let's turn them over. Okay. There's no dryness. Now let's check your pulse. Okay. Pulse is less than, capillary refill is less than 3 seconds on both hands. Now let's see. I'm going to have you, there's no, can I see again? There's no denting in the nails. There's nothing like that. The nails look normal and pink. Capillary refill was less than 3 seconds on both hands. Now let's, I'll have you, can you squeeze my fingers? Okay, good, perfect. Your strength is good. Now we're going to have you, let's see, there's no abrasions, there's no scratches. Everything looks good with the skin on your arms and your hands. Now let's see. Now we're going to check your lungs, okay? Can I see your back? Lung sounds are clear? Okay. Thank you for taking a deep breath in while I was checking your lungs. Now we're going to, we did your lungs. Now we're going to, have you lay down. Okay. Okay, we're going to provide patient privacy, but normally we would ask that they lift up their shirt. We're gonna have you lift up the shirt. We would have them lift up their shirt, and we would look at their abdomen. We're going to be looking for any skin intactness. Can I have you sit up? Sorry. We would have them lift their shirt, and we would check the tailbone to make sure there's no breakdown of the skin anywhere on any bony prominences. Going to check the elbows. Okay. Can I see your other elbow? Okay. There's no skin breakdown on any of her bony prominences. So now we're going to move on. The next thing that we're going to do is going to palpate the thorax, okay? So I'm going to put my hands on your chest, and you're just going to breathe, okay? Okay. Ready? Okay. Okay, good. Perfect. Okay. So now that we did that, that was normal. You didn't have any pain, right? No. Okay. So that was normal. So now that we palpated her thorax, she took a deep breath in and deep breath out. While I was doing that, it's symmetric. Do you have any problems with coughing? No. No. Okay. Perfect. No coughing. Going to be assessing your breathing. So your breathing, you're not having any trouble breathing, no shortness of breath or anything like that? No. No, okay. Okay, now that we did that, now we're, she doesn't have any she has no labored breathing. Her oxygenation is 100%, on room air. Let's see, and now that we're here, is it okay if I check the rest of your vitals since we're already here? Okay, so we did the BP. The BP was 120 over 63. Okay, and check the temperature, temporal temperature. Okay, let's see, temporal. Good. Okay, 98.6. And then we said we checked your oxygen. It was 100%. Respirations is 18. Are you having any pain? No. No? Okay. And 0 out of 10 pain. Okay. Now that we did that, is it okay if we move on? Okay. Now that we're moving on, now we're going to, lung sounds were clear, no labored breathing. Now we're going to check your heart sounds, okay? Now we're going back to the apical, and we're going to listen for a full 60 seconds. Okay, S1, S2 present, no S3 or S4. Now that we did that, there's also no galloping noted. So there's no S3, S4, there's no galloping noted. Now we're going to check your pulses, okay? Okay. Can I have you go like this? Okay, we're going to check your pulse here first. Okay, perfect. Thank you. Now that we checked those pulse, the radial pulse, they're 2 plus bilaterally, and now we checked your cap refill. Okay, you already have your shoes off. Perfect. Now I'm going to check the capillary refill on your toes. Okay. Okay. Are you comfortable with taking your socks off?
Yes.
Okay, can you go ahead and take off your socks so I can check your capillary refill on your toes? Okay, that's okay. Capillary refill on the toes was less than 3 seconds. Now I'm going to check the pedal pulses. Okay, now I'm going to check okay, perfect. Okay, if you want, you can go ahead and put your socks back on. So the pedal pulses and the tibial pulses are 2 plus. Okay. Now that we did that, we checked your pulses, we checked your feet. There was no breakdown that I seen on your feet. Your feet look dry and intact. There's no rashes. There's nothing else noted on your feet. Skin looks good. Let's see. So we checked your pedal. We checked your tibial pulse. We checked your radial pulse. All of those were 2 plus. Now let's see. Can I ask you a question? Okay. Are you having any problems with urination? No pain while urinating?
No.
Okay. When was your last bowel movement?
A couple hours ago.
Okay. And can you tell me a little bit more about your bowel movement? The texture?
It was soft.
Was soft. Okay, perfect. Okay, so you're not having any problems with your bowels or your urine?
No.
Okay. Okay, just checking. Okay, now after we did that, now I'm going to, is it okay if I have you lay down?
Yes.
Okay, go ahead and lay down. Okay. Normally we would have them lift their shirt, but for privacy, we're not going to lift their shirt. Now we're going to palpate the stomach. Okay, first we're going to start with light pressure, and then we're going to go, and then it'll be a little bit more firm. Okay, is that okay?
Yes.
Okay, and she just urinated, so she should be okay when we press on her stomach. Okay, ready?
Yes.
Okay, and then also when the patient lifts their shirt, we're also going to check the abdomen for the skin. We're going to make sure that the skin looks. We're going to make sure that the skin looks like it's normal. There's no rashes, and her stomach is symmetry. Yeah. Okay, ready?
Yes.
Okay. Just let me know. Let me know if it hurts at all. Okay. Okay. Any pain?
No.
Okay. Now we're going to do a little bit more firm. Sorry, I know it's ticklish. Okay. No pain?
No.
Okay, perfect. Okay, so there's nothing noted. Her skin looks her abdomen looks symmetry. She's not having any pain with palpation. Um, she she's not having any she's not having pain with palpation. She's not having any pain with urination. She's not having any problems with her bowels. Okay, now I'm going to listen to your bowel sounds. Okay. Okay. Her bowel sounds are active in all 4 quadrants. Okay. Okay, now that we did that, now let's see. We palpated you're not having any pain. Go, since we have you right here, can you go ahead and move your toes around? Okay, and then can you move your feet around? Okay, range of motion looks good in her feet. Let's see. Can I have you stand up now? Okay, and you're going to bring one of your feet and you're going to rub it against your leg. So just kind of like this, like kind of go up. Okay, can you do it on your other leg? Start from the bottom and bring it up like that. Okay, perfect. Any pain?
No.
Okay, looks good. Okay, now that we did that, now I'm going to have you, I'm going to step back and you're going to walk and then turn around and walk back, okay? Okay, any pain?
No.
Any problems while you're walking?
No.
Okay. Now that we did that, we checked that, we're going to have you, let's see. We checked your range of motion, you're good. Your gait and your balance looks great. You have no problems with your gait or your balance. Let's see what else. Your coordination, you were good. And can you go like this? Put your arms in circles. Okay. Any pain?
No.
Okay, good. Okay, so that looks good. Now you're going to put your hands up. You're kind of going to go like this. Can you go like this? Okay. And then while you're doing that, I'm going to put resistance on you and you're just going to push back, okay? Okay, go ahead. Okay, perfect. And then now that we did that, we're going to let's see, we did that. Now I had you squeeze my hands earlier and your strength was great. Now that we did that, now I'm going to have, let's do it one more time. Go ahead and squeeze my fingers. Okay, perfect. Okay, the strength is the same on both sides. She has no problem with her strength. Now that we did that, I'm going to have you do we tested your extremity and your range of motion. Now we're going to do your lower six. Go ahead and have a seat. Let's check this. Okay, we're going to do, we checked your feet. You were able to move your feet and your legs in circles, your toes and your legs in circles. Now that we did that, I'm going to check your reflex. Is that okay?
Yes.
Okay. Okay. Okay, perfect. Okay, your reflexes on your knees are good. Okay, now that we did that, now we're going to give you some patient education about your tonsillectomy. So we don't want you drinking hot liquids. Try to drink cold liquids so it'll help with the discomfort that you have in your throat. You will feel discomfort for a while, but it should get better. Let's see. Can I just, now that we're here, can I just check your tonsils in your mouth? Okay. Okay, go ahead and hyperextend your head back. Okay, perfect, thank you. Okay, there's no tonsils, present, and they look, your mouth looks, it looks a little red, but it should be getting better as the days go on, okay? If you have a fever above 100, we want you to contact your physician right away. If you have a fever for greater than 100 for more than 2 hours, go ahead and contact your physician then, okay? Okay, do you have any, questions?
No.
No? Okay. Okay, no questions, we did that, let's see, now I'm going to take my gloves off. Okay, are you comfortable there?
Yes.
Okay, so I left my patient comfortable, and my patient is, the bed is lower to make sure that the patient is safe. And then we explained to them when they should call the provider. Now I'm going to throw my gloves away, and I'm going to perform hand hygiene, and I'm going to leave the room and then chart the results. Thank you for allowing me to assess you today. Have a good day.